Okay, so good evening, friends, and welcome to another amazing episode of Crossing Boundaries. We are in session 9. And today we're going to talk on a very important topic called lasers beyond dentistry. And I'm sure all of us are very curious to know what it is all about, right? So you would have heard a lot of people talking about a lot of skin warts or, some kind of skin blemishes, fine lines, wrinkles, pigments, and all these stuff, right? So I'm going to tell you that it's a great pride for all of us to help you understand that we do all these services at Dr. Vidya's Smile Dental Clinic. And I'm going to show you some cases and I'm going to tell you the future where it lies, right? So with no further ado, I'm going to start sharing my screen and we'll be going ahead with the presentation. So good evening, friends, and welcome to today's topic. We are talking about lasers, which is having a promising future in dentistry and beyond. So I'm sure all of us now understand that lasers is the in thing, right? So no school or college culturals or no TV events or any award functions is without lasers. At the same time, we understand that these lasers actually add a lot of glamour to our everyday life, right? If you start looking at going to a supermarket, even all your products, whether it is your grocery or your vegetables, whatever it is, they are all barcoded, right? And you have this UPC scanner that is nothing but laser, and it just reads that imprint of the barcode, and thereby you are able to buy your vegetables. So everything is so laser. And we also talk about laser focus, wherein we think about anything where we want to really put in our 100% effort. We say we are laser focused. So now I'm going to talk to you, as I told you, cases in lasers in dentistry, and this is very important because many a times when patients come to us, they always tell that we came for a dental issue, but many a times they also talk about doctor, we have some wart or something on the face, would you help us do this, because lasers as such is a painless, bloodless procedure. So I'm going to show you certain cases where you will be able to see that they are absolutely bloodless, and this can give you a lot of belief. Now, why do I say that? It's because when a patient comes to us, their whole concern is that, they want things to be very comfortable for them. I'm sure everybody will want it that way, correct? Nobody wants something which is going to be painful for them. At the same time, they are a little scared or skeptical about how will it be for them. So this is very important for all of us to know that how can we, ease out this kind of a feeling for a patient. Now, in our clinic at Dr. Vidya's Smile Dental Clinic, we have two kinds of lasers. We have the diode laser, and we also have the erbium chromium YSGG, which is a 2780 nanometer or the wavelength laser. Now, here is a patient who had a wart on her face, and she was a little conscious about that. So what we need to do is we just take the laser and go towards that wart, and easily we can remove it. The first question generally what people ask me is, should we anesthetize that area or should we numb that area? So the answer is not really. If you want, you can apply some topical anesthetics or you can apply a spray, and then you can go ahead with the procedure. And we use certain parameters on the machine just to control so that we can remove this wart without any pain for the patient. So you can see these pictures just to help you understand the wart. And so this is how you can actually remove that wart away. And you can see it's a very clean area and absolutely no blood at all. And the patient is very comfortable. We generally give what is called the laser safety goggles or safety glasses. So these pictures were taken after we removed the glasses. So it is very important for us to understand laser safety also before we work ahead with these kind of procedures which are very close to the eyes. So you can see that is before when she had the wart, and that is 1 week later with a healing area. So during this healing period, the patients are very concerned. They say that, they did not have any pain. Generally, what are the after care instructions for such patients? We ask them to apply ice on that region as soon as they go back home. And once they apply ice, then, they can do whatever they want, in the sense that, they can wash their face and all that. And there is no particular restriction of anything of that sort. We generally tell them to have some painkillers in case they have pain, and apply some creams over that, or vitamin E or the Evion capsule, you can apply that. Vitamin E is generally called a skin vitamin. So, it is very helpful when you just apply it on the skin. So this makes it very, very easy for the patient also. Generally when I call them after a week, they say, ma'am, we didn't apply anything. We didn't have any pain. It was very comfortable. And I didn't even know that, a procedure was done. And that is how they keep sending more and more patients to us. So it becomes quite easy for us to work out on these kind of patients. I'm going to show you another case right now. So right from the face, we are now moving to the hand. Many a times we call something like, when you have a sharp pencil or a pen between your fingers as you write, and you exert a lot of pressure, you have these kind of growth. They are not painful. So generally this growth are painless in nature, and it keeps growing as the person grows, and after some time it becomes unsightly for the patient, right? So again, we had the laser. So all we had to do was, just use the erbium laser, and we had to cut that overgrowth, and we had to remove it. Again here, we did not give any infiltration or any injection. We just applied a topical application of the anesthetic and a spray, and that was good enough for the patients. That's immediate post-op. You can see a little bit of the connective tissue along with the epithelium has been removed. Sometimes the cut can be quite deep. So if there is any attachment, we would like to remove that. And the healing, you can see that's a 1 week post-op, and absolutely no signs or traces of such warts even in the hands. This is very important because see, when we look at aesthetics, when I look at anything which is abnormal on the surface of the body, patients are very concerned about it, and they would like to remove those areas. So this is how it was pre, and this is how it is post the procedure. And it is very clear for us to understand that, the patients are very comfortable. Otherwise, they will not just come for the sake of a picture, right? Now, I'm going to show you another case. This case is a kind of a birthmark on the chest of the patient. So this patient used to be very conscious of these birthmarks, and she used to always wear very high neck clothes. See, generally when you wear high neck clothes, you are able to cover your chest area, but sometimes overly high neck also might be a little uncomfortable. So here again, we took our laser, and I'm going to show you a short video right now so that you'll be able to appreciate this case. So now you would have been able to appreciate that, it's so very easy for the patient to undergo the procedure and absolutely no scar formation. Now, this is something which I just loved as I was working on the skin. So generally when you do any procedures on the skin, there will be a scar, and then you need to do something called the scar revision, just because you don't want anybody to know you had some procedure there. But with lasers, it becomes so very easy to just, completely clean up that area. And lasers are bactericidal, so there is no infection getting spread in those areas. And that is how you can see this is a 10-day post-op and a 1-month post-op also. So that makes it really easy for the patient, and that's how it was pre and post. Now, as I showed you the video in this particular case, I wanted to tell you that this is not an edited video, which means that, it was a real time or the exact time which took for me to do the procedure. So in about 10 minutes time, you can actually call the patient, make them sit down and complete the procedure and send the patient for remarkable differences in their life. And then, they say the rest is history. So once you get the procedure done and the healing is complete, the patient, flaunts wearing different types or styles of clothes. And it is like, giving them a better chance to live comfortably. Another case right now. This is a case which we do very often within our practice. You'll be able to see a lot of warts. So these are multiple small warts on her face. And you can see that we're just taking each wart one by one and we are removing, and they're multiple. So it's all over the face, all over the cheek. And this is how it is immediately a day later. You will see like as though, there will be some bite marks, something like that. And after a week, you can see that, scab tissue just coming out. And then you will see a nice light pink epithelium underneath. And within a month's time, everything is gone. And it really helps the patient also look good. Now, at this point of time, I would also like to say that, we at our Smile Dental Clinic, we have a fractional handpiece, and this handpiece, I can tell you that it's the first of its kind in the entire India and Southeast Asia. And here with this handpiece, we actually try to remove all the wrinkles, fine lines on the face, hyperpigmentation of the face, and the freckles of the face, and also try to help patients look younger, or make them feel younger, especially with their look. So these are a few precious moments with my mentor, Dr. Pradhan sir, and of course, Dr. Ralph Borchers. And as Charlie Chaplin says, the only one thing in this world which will increase in size after sharing is happiness. So with that, actually, I come to the end of today's presentation, but then I would, wait to have your questions in front, so that during the session, it would help us, answer your questions. So if you have any questions, my dear friends, you're free enough to ask. So it will help us, have a very interactive session. So anyone who wants to share, you're free to ask. Are there any questions?
Good evening, Vidya.
Hi, good evening, Sandil.
Yeah, all these are done in a soft tissue laser, no?
No, the procedures, what I have shown is all done with the erbium laser. Erbium is a hard tissue laser. We use the component of different parameters where we work it on the soft tissue. The reason why we use erbium lasers is because it is a surface laser. So the penetration depth is less, so there is, less damage to the underlying tissue. So that becomes an advantage, especially when we are thinking about the lasers. With a soft tissue laser, what will happen is, since the depth of penetration is high, we prefer using the erbium lasers or the hard tissue lasers. Even though it's on the soft tissue, what we use is the hard tissue lasers, which is called a dual laser. I had another question in the chat box. Thank you, Ruchi. I guess you asked me, can we use diode also in these cases? I just explained it. Thank you for your feedback saying that they were great cases. Thank you. Actually, I have a lot other cases, but I cannot expose all patients' work. The reason is because some patients have not given permission to, showcase their cases. I have done a lot on the thighs of the patient where they have marks. I have done on their private parts also. It really works wonders, especially, when you are trying to make a game changer for them. I have also done a lot on the lips called lip depigmentation procedures. Many girls, especially girls, and one patient was a male also. And this particular case I have published in the International Journal of Laser Dentistry. And here what we did is we tried to, de-epithelialize the lips. And we could give them nice baby pink lips, especially because, sometimes these lips are multicolored. You will see a little bit of brown, a little bit of white, a little bit of pink here and there. And overall, it might not give a very good look for the patient. So patients are a little concerned, and especially when they're going to get married and they want to look good, they always, look at all these concerns. So that is the reason. I have used only erbiums at these. For the lip depigmentation, I did use the diode, but I would still prefer using the erbium to the diode. Thank you, Ruchi, for that question. And thank you, Sendil, also. Any other questions or feedback, you can definitely ask me. We still have time, and it will help us answer your questions in various formats. See, there are certain times when you might fear in asking, so this is the best time to do so.
Hi, ma'am.
Hi, Mary.
It's very nice, interesting this one because I have heard about it because my sister also is dentist. But I've heard about it, but you have explained it very clearly. I understood. Not very well also, but very clarity you gave. Each session is your session. Each session you do justice to the topic. So in that way, I get very enthusiastic when your session is there. Unless I have hectic work, I can't attend. Others, max to max, I attend all your sessions. So all the best, ma'am. All the for your next session. All the best for your life also. God bless you.
Thank you so much, Mary. Thank you for the feedback, and thank you for attending our sessions on a regular basis. All our sessions, the previous sessions, are all recorded. Even this is recorded, and they're available at YouTube. I will share my YouTube channel. It's called Team Red Rockstars, Dr. Vidya's Smile Dental Clinic. So you will see that these come under the series called Crossing Boundaries. And you have all these, sessions recorded. Thank you, Dr. Sendil. You've said it's an eye-opener, thinking beyond dentistry. Thank you so much. Truly means a lot.
Hi, Narmada.
Oh, hi, Narmada. Tell me.
Yes, very nice your lecture. I'm hearing. What is the contraindication of this case?
Wonderful. Thank you so much for attending, Dr. Narmada. So lovely to see you here. And thanks for the question too. So contraindications, that's a nice question. So generally, when we say, how do I work around it? My patients generally ask me for the procedure. So coming back to the question. So first thing is, my patients keep asking me, Doc, I have a patch here, I have a mole here, will this go away with lasers? So I'm very particular that, there is a need for the patient. Okay, the patient asks for such procedures. Second is that, how interested or how anxious is this patient? So being a psychotherapist and a counselor, I also counsel my patients before the procedure so that there is no apprehension as I work on the patient. I generally show them some previous cases also for them to feel very comfortable. Now, when I look at can I do it on patients and what are the contraindications? So generally, when we think about any skin work, I'm very particular that they don't have any fresh wounds or bruises in that region. I'm also very particular that they don't have any, pimples or anything in the area that I'm going to work. If it is so, then I give them some creams, I help them recover from that, and then I do the procedure. Most of these procedures are elective procedures. Elective means I can do it at a later date. It is not an emergency. And that gives me a kind of a freedom to, educate my patients also. Next is I also look out for patients in case there is some family function or wedding or something like that where they want to look good. Then I will definitely have a leeway of say at least a month's time. And I'm very particular that there is nothing on their face which will be indicative that they had a procedure done. Now, this is something which we can talk to the patient before and prepare them well, especially because, see, you want to look good and you would not want to have a scar, especially when you're going out for a wedding or something like that. So contraindications, not really, but then these could be like, relative questions, which I would be asking my patients well in advance before I do the procedure. And aftercare, I told you, is just to apply an ice cube or, a vitamin E. Now, when I do a lot of skin procedures, I also give them various types of, skin creams and also help them understand the need for a good skin care. Like the last case I showed you in this particular procedure, I showed you this girl had a lot of facial warts. So I generally ask such patients, what is the skincare you do? So mostly the patients say, oh, doctor, I don't do anything for my skin. So, these answers gives me a lot more responsibility in teaching them about basic skincare. So see, our skin is nothing but multiple pores. And once these pores are exposed to the outside environment, there is a lot of dirt and grime and your sweat and everything on the face. The least you can do is before going to bed, wash your face nicely. Then people ask me, doc, should I use a face wash, or what is the face wash I need to use? Or, can I just use a soap and, have a clean face and go to sleep? So these are things which we need to understand. So I generally tell them that a face wash is better than a soap. So that's the first thing. Second thing is I also tell them to have healthy diet. When I say healthy diet, I'm talking about good, nutritious food. So if you want to flaunt a good skin, I'm sure you should be eating lots of fruits and vegetables, lots of soups, lots of water intake, because as we all know, our skin, the entire body is 70% of water, and the skin to glow, you need to have that water content. The skin should be hydrated. That's what we say. So keep hydrating yourself, especially if you're thinking about long hair and skin and nails, you need to have a lot of water. Okay. Next is exercise. So, when you exercise yourself, your face is a lot more toned and it looks good. Now, coming back to, any other blemishes. So in case there is pimples, then I also ask them, especially in the teenage, that category of people. I ask them a little more about their monthly cycles. I ask them whether they have any PCOD and things like that. So proper case history or a medical history is very, very important, especially when you're doing such cases. Let's come to depigmentation or pigments on the face. Now, when you see pigments, you should understand either there is over skin exposure. When I say over skin exposure, I ask them, see, now everybody is covering their face and wearing a mask and going around. But imagine if your face is totally exposed to the sun. I'm sure you all know about the UV rays, that is the ultraviolet rays. You have the UVA, UVB rays, and you also have the UVC rays. So now I will ask them, when you go out in the sun, do you feel your skin is burning? Or you feel your skin is aging faster, or these patches have suddenly come out, or how often do you go out in the sun? See, now suppose if it's a runner, or if it's a person who is into sports or into swimming, so they will have a lot more of these. So I try to understand the lifestyle also of the patient. So having all these information in hand is when I start the procedure. And depending on this, I give them the solution, and it also helps them understand their skincare better. So if a person is saying, you know, I'm having wrinkles, now I am not going to, totally help them remove all those deepened wrinkles in one sitting. It will take time. So which I mean, like, you know, you have the epidermis, you have the dermis, and then you have the hypodermis. In the dermis, we have the elastin and the collagen. So these two are proteins basically. Now there is a breakdown of those proteins, and that is why your skin, like, when you are a baby. So when you touch your skin, you feel really soft, but as you grow old, you feel all those lines and wrinkles coming. Now this particular person might not have enough proteins. So then I would say you need to have more protein food and supplements and things like that. So it's very important for us to take a proper history, not only of the past medical history, the present medical history, the diet, the lifestyle, and their skincare regime. So all of this we need to understand, because the after treatment, the care, the procedure might be the same for everybody, but nevertheless the after treatment care will be different for people. And then they need to get into a kind of a routine. So going back to that patient where there were a lot of warts all over the face. So this person never used to take care of the skin. So I got them into a basic skincare routine. I got them into a weekly skincare routine. And now she says my skin is glowing. In fact, my skin is looking much younger than it was, 10 years back. So that is the key word. So the more you take care of your skin, and the more you pamper yourself, your skin is going to pay you back that way. You will be, you should be ready for all those compliments too. So that will be the advantage. So I hope I answered your question, Dr. Narmada. If you have any more questions, you can ask me too.
Dr. Vidyaa.
Yes, Dr.
Can you do a depigmentation for mosquito allergy?
It depends on the scar. It depends on the scar, doctor. Definitely it can be done. I have done it on many people. So if it is a recent injury, I wait for the injury to heal, because there'll be inflammation there. So I wait for the inflammation to heal, and then I do it on the procedure. And if there is a recent bruises also, I don't do. I wait and then I do it. The healing, the post procedure is very, very rewarding for the patients, and they're really happy with it. All those pigments will go away. Thank you for the question.
Any limitation for the penetration of the laser?
When we use the erbium lasers, it is a surface laser, so it will not go more than 5 to 10 cell layer deep. So that is the advantage. And it will give you much better output. The only thing we generally tell patients is that, see, you might have microbleeding. In case it is there, nothing to worry. Within 24 hours to a week, you're going to be completely fine. There is no restriction whatsoever. You can do anything normally. And generally, patients say they were comfortable post-procedure. So there is nothing to worry about in those cases.
So no limitation for the penetration of the laser tip?
No limitation. We work on it a very calculated way. It does not, we don't push the laser inside. The laser beam works inside.
Okay.
It's only 5 to 10
And then,
seconds.
okay. I saw all your videos post-operation. It's nice to see everything. How much charges you are charging generally?
I think that's the most important question, right? How much money to charge? It depends. I mean, I can't give you a thumb rule and say this is the amount I charge. Nevertheless, it depends on the area of the work, the number of watts or whatever it is, and the depth. Like sometimes you might have very deep penetrated one, especially when I do it for the neck for women. All over because they wear thick chains and because of constant irritation, you'll have a lot of warts even on the neck of the women. So this is all very important that we, help them feel very comfortable. Today, when you want to wear backless blouses or deep back blouses, you want to look good, especially on the neck region. So we teach them how to maintain that area, and I give them some home remedies, some tips also. It is more on case-to-case basis. Even the cost and the aftercare, as I told you, it's very individualized because it's a very personalized problem with a personalized solution. The procedure might be the same, but the case as it comes and the way we do it might become a lot more personalized.
Hey, approximately, I'm asking you because I am in rural area, you are in city. So whether I can buy laser or not, whether I can gain or not, is it gain one or not? That's why I'm asking. Approximately tell Chuma.
It is quite tough for me to give a concrete answer. However, as I told you earlier, this is nothing to do with rural or urban city or position or anything like that. The only thing which I have felt is the patient need. I have certain pictures of my before and after patient work on my operating, in the waiting hall. And as people look into that, they ask me, ma'am, I have this. Can you work out on this? I'm feeling very conscious about it and things like that. So as they ask me, I'm able to cater to them. And then they tell me, oh, you know what? I paid so much there, but still it has come back. Or I have done this and nothing is working on me and things like that. So I always sit and listen to all this, and only then I come up with a solution. I feel it is very important for us to be a good listener and understand the patient needs, and then tell them the charges. And mostly when we say patients agree, because we are not going to charge them the roof. They know that we're going to pay for whatever they have already done. And ultimately, they need a solution. So we become solution providers by giving them, a complete package of the procedure and the treatment plan. And mostly today, it is into aesthetics. Aesthetics means looking good. It could be dental aesthetics, as in your teeth. It could be your lips. It could be your face. It could be your neck. It could be anywhere. But everybody wants to look good. So I think, people pay when they understand the need for it. It is very simple for us to help them understand that need. That's it. If they are going to come to you, it's going to help you, work on it very simply. So,
okay, thank you. If I want to buy the laser, how much it cost approximately? Where to buy? What is the model I have to buy?
Absolutely. You can contact me after this course. We will be helping you with that. I also conduct courses in our practice. So we will feel free to come over and learn. You can join the tribe and listen to our programs also. I hope you all had a great evening understanding a little more about lasers and beyond dentistry. Definitely we'll come back with another great episode for all of you to listen to. So this is Dr. Vidyaa Iyer signing off. Take care. Love you all, and bye-bye.